Dr. Anthony Fauci is joining us now to talk more about his first meeting with the president-elect and where things stand with the virus and the vaccine. Dr. Fauci, as always, it's good to see you.
Thank you.
We are now faring worse than many feared. We are seeing more deaths than ever before in this pandemic, more hospitalizations and cases. I think about us talking back in March and April. Is this worse than even you had feared?
Well, I think it's at least as bad as I had feared, Savannah. You know, we're in a very precarious situation right now. There certainly is light at the end of the tunnel with a vaccine, but we're not there yet. So we really have to intensify our public health measures to try and blunt this trajectory, which is really significant. Yeah. You know, it's a combination of things. It's a combination of getting into the winter, people spending more time indoors, combination of the holiday season, people doing the normal, wonderful things of congregating together at meals with friends and family. You know, as innocent as those things seem, in fact, those are the things in many respects that continue to drive this. And now that we're approaching the Christmas season, it's even more of a challenge. So this is a tough situation, Savannah. It's not easy.
I was going to ask you, it's been 8 days since Thanksgiving. Do you attribute any of this surge that we're seeing in the last couple of days directly to Thanksgiving and the travel and the get-togethers that did happen?
Maybe a little bit of a blip, Savannah, but we don't expect to see the full brunt of it between 2 and 3 weeks following the Thanksgiving. So I think we have not yet seen the post-Thanksgiving peak. That's the concerning thing, because the numbers in and of themselves are alarming. And then you realize that it is likely we'll see more of a surge as we get 2 to 3 weeks past the Thanksgiving holiday. And the thing that concerns me is that it butts right on the Christmas holiday as people start to travel and shop and congregate. So that's the reason why we plead with them to please, as best as you can, uniform wearing of masks, keep distances as to the best possible way you can, avoid crowds in congregate settings, particularly indoors. And if you are indoors in that circumstance, always wear your mask.
Director Redfield of the CDC said it is going to be a situation where we could have 450,000 people dead by February if nothing changes. At this point, do you feel that that's more likely than not?
Well, you know, I hope that that's not going to happen. And that's the reason why all of us are out here telling people, literally pleading with them about the fact that we can do something about that. It shouldn't be despair where you throw your hands up and say it's inevitable, it's going to happen. If you do the fundamental things of public health measures, you can blunt it. And now probably is more than ever to double down on it, because vaccines are literally at the threshold. We're going to be starting to administer to the higher risk people and to people who are the healthcare providers in mid and late December. And then as we get into January, February, and March, more and more people will be able to get vaccinated. So now's the time to hang in there and not give up.
On the subject of the vaccine, you told an interviewer that the Brits rushed through their approval, that they basically took the company Pfizer's word for it, and that the regulators here in the U.S. won't do the same. That didn't go over too well with your friends across the pond. I know you took it back to a certain extent, but were you speaking the truth? I mean, did they rush the approval?
You know, I don't know. I don't think so, Savannah. The reason I apologized publicly on BBC about that, and I felt badly that it came across that way. The reason it did, it was just one of those things where I sat down in front of the TV with a British TV station, and the first thing they said was, we beat you guys. We beat the Americans to the punch. And I kind of reacted back at him when I think I probably should not have done. But when I got back on BBC, I explained that that was taken out of context. No, the Brits are good. They know what they're doing. I mean, they're really pros. So that was just not really what I meant.
Well, I guess that raises the question, what's taking us so long then? If they can approve it, you know, should we be moving faster?
Well, no, that's a great question, Savannah. In fact, our process is a little bit differently. What our FDA does is that they scrutinize every single bit of the data themselves. They don't just take the word of the company. They're really a reviewer for a journal. That's just the way they do it. It's a little bit different than what other regulatory agencies do. I'm not saying it's better. I'm not saying it's worse. It's just different. But We are, and I won't back down on this. The FDA in the United States is the gold standard for regulatory, looking at things like drugs and devices and vaccines. There's no question about that, and I certainly wouldn't apologize for that.
A huge challenge is not just getting the vaccine out the door and into people's arms, but convincing them to get it. I've seen a survey that showed 36% of nurses saying they weren't going to get it. The question is, how do you know it's safe long term? I mean, you could trust the regulators, we could trust you, we could trust the drug companies, but no one got this shot until a few months ago. How do you know it's safe long term?
Right. Well, that's an obvious good question, Savannah. And what you do is you look at the history of vaccinology and you look at all the vaccines that we've done. And when you see these types of adverse events occur, and when you analyze that, you see that the overwhelming majority, more than 90% or more of them, occur somewhere between 30 and 45 days. And that's the precise reason why you remember back a couple of weeks ago the discussion that the FDA said they would not issue an EUA until they were 60 days beyond when half of the people received their last dose. So they've already baked in that 60-day period of observation before they do anything. So right away, they will have captured the overwhelming majority historically of when you see so-called long-term side effects of a vaccine.
President-elect Joe Biden said in an interview yesterday on his inauguration, he's going to ask Americans to wear a mask for 100 days. He said just 100 days, not forever. Is that enough, or do you feel like that might put an artificial time limit on how long people may need to be wearing masks?
No, he didn't mean it that way. I spoke to him about that. What he wants, he just wants to get, and it's a good idea, uniform. He's saying, hey, folks, trust me, everybody for 100 days. Now, it might be that after that, we still are going to need it, but he just wants it, everybody for a commitment for 100 days. And I discussed that with him, and I told him I thought that was a good idea.
He also said when he spoke to you, he asked you to continue in your role, which you've had under 6 presidents, but also to serve as his chief medical advisor. Will you do that? Did you say yes?
Oh, absolutely. I said yes right on the spot. Yeah.
Some folks think that seeing high-profile individuals such as yourself, some surveys say you're at the top of the list, former presidents have offered to get the vaccine when it is their turn on camera. Do you think that's a good idea? Will you do that? And are there any other names you'd put on that list? Any other high-profile celebrities you think, hey, this could make a difference? If they get the shot and everybody sees it on camera, people will have confidence.
No, that's a good thing. We had our past presidents. We had President Clinton, President Bush, President Obama, President Biden. President-elect Biden said he would do it. I think as many people who the public can relate to, and the public relates to different types of people. Some relate more to presidents, some relate to sports figures, some relate to entertainers. Anyone that can build the confidence in the public about getting vaccine would be a good thing, because we really do have to get as many people as possible vaccinated, because having an extraordinarily efficacious vaccine like we do have, for sure, 94, 95% efficacious, it doesn't mean anything if people don't get vaccinated. And that's the reason why we're really pushing the envelope on that.
All right, Dr. Fauci, thank you so much. Appreciate your time, as always.
Thank you for having me, Savannah. Appreciate it.